This is a juvenile green sea turtle that was found at Rangiputa Beach at Kohanga Bay. The Department of Conservation Rangers brought her to us. She was found stranded and we think cold shocked, which means that her body temperature was far too low for her to function normally, and that leaves them susceptible to infections and injuries. When she first came in, she was a lot quieter than this. We put her in fresh water, we warmed her up slowly. We placed this IV line into this vein in her neck so that we could give her medications and fluids. She came in with this shell defect here, but this is an old wound. This is something she probably sustained from a predator or potentially a boat that she's survived, but there's something else going on which we're investigating today. When they're sick, they just float in the ocean and they get what we call epibiota, which is all the algae and barnacles and things. So when a turtle comes in covered in this, we know that they've been sick for quite a while. When the barnacles are alive, they're really firmly attached. And if we were going to try and pull them off, it would actually cause quite a lot of pain. So we put them in some fresh water to keep them hydrated, and it also kills off all the algae and the barnacles. So these will come up as big white spots on the X-ray, and what we want to do is be able to see her lungs, so we don't want those in the way. Now that we've removed the barnacles, we'll be right to do some X-rays and take a blood sample. We're not getting it from the cannula because it's an old cannula, and we want to make sure we get accurate results. So what we're doing is we're just extending her neck gently so that I can take a sample. That's enough for a nice stat. Great. So we'll just have her facing this way. Yeah. X-ray. So we can't really lay her on her side. So we just keep her upright and then we change the X-ray. You can see the X-rays go this way so we can get a picture of her lungs. These are our top-down X-rays of her body, and then these are the side-on views over here, and then this is the face-on views. Today, we have actually seen that on her left flipper here, she has a little dislocated toe. Because the bone looks healthy on the X-ray, we're not going to do anything. We're just going to let the body do what it does and heal over time. We will monitor this though, and she might need repeat X-rays of her foot in the future, just to make sure there's no infection. And actually you can see some barnacles that we didn't take off here and over here, so that's why we had to take them off. Otherwise, they would have been over the lungs and we wouldn't have been able to see anything. So this is an X-ray looking at her from head to tail, and we're looking at her left and right lungs. And when we look at lungs, we expect them to be very dark in color on X-ray because air is invisible to X-rays, which means that they appear black. So if we're seeing gray and white, it means that there's something there. And in this X-ray, around the center here, there's a lot of gray, a lot of mottling that's abnormal. And normally we might be able to see blood vessels and airways, but we can't see that here. So I'm very suspicious that she's got pneumonia, and it's good that she's on treatment for that already. Once turtles are warmed up, it's often after they've spent a few days here with fluid therapy, we start to feed them. And because they're often not interested in eating yet, we have to pass a tube down into their stomach in order to feed them. So we've done that today after our diagnostics. There we go. And then this tube stops her from clamping shut on the feeding tube that we're going to pass. We've got the tube in, we can pass the food down the tube. So the path from here is treating her for her pneumonia and also continuing our supportive care. So making sure she's eating, making sure she's getting her medications, and probably rechecking X-rays, blood tests, and potentially even a CT scan in the future, just to make sure everything's going in the right direction. The green sea turtle that we've been treating for pneumonia has done really well in the clinic, so we transported it to the team here at Kelly Tarleton's for the next phase of its treatment. It's been here for about 6 weeks. This is one of the hospital tanks. You can see we've got many different tanks here, not necessarily all for turtles. They come in here, they've got a nice area where they can swim around, and this is where they can get fed and chill out. The water's heated and filtered. She's been closely monitored and receiving medication for her pneumonia, but she's still not really eating on her own, and that's quite unusual. We have scheduled this blood test as a recheck in general anyway, but it sounds like it's really needed today. So we're going to try and coax her up with this net here so that we can lift her out of the water. We're not actually trying to net her, we're just trying to disturb her a bit so that she'll surface. She might be coming up for a breath. There we go. The team here is really good that they make sure the turtles are going okay. They give them their medications, make sure they're eating, weigh them regularly to make sure everything's on track.
It's been a bit of a roller coaster. We were tubing and then she was trying to eat and we thought she'd eat, but now we're back to like square one again.
And it's all right. We're just gonna cover your face there so you can relax. 12.8 kilos. All right, let's have a look. Okay, sweetheart, I know. Bit of a bruise there. This year has been particularly busy. We've received a lot of turtles. We first see them at the zoo, we get their initial treatments and diagnostics and everything started, and then they come here to Kelly Talton's.
And then they just go in quarantine. We give them their meds and make sure they're eating well. If they're not eating, we have to tube feed. Once they're eating well and they're off their meds and we get all good, then we'll get to put them in Turtle Bay. Turtle Bay is our big oceanarium that we've got out in the aquarium where we put all of our turtles.
It's amazing seeing the turtles in the aquarium when they're getting better. There's quite a few green turtles out there. We've also got a hawksbill swimming around out there, and it's just stunning to see.
We just keep monitoring them and weighing them, making sure they're all good until we can release them.
Turtle medicine is really hard, and reptiles in general act a lot slower than a mammal would. So it could be a couple of months you think they're going well, and then all of a sudden they make a U-turn and just don't go well. We might not find out what's wrong until they unfortunately pass away, and then we need to do some post-mortem diagnostics. So even though when they come to Kelly's we're really excited and they're happy to be getting treatment in the next phase of their treatment, they're not out of the woods. It could take sometimes years to get them to the point of release. We don't know exactly what's going to happen yet in terms of what the results are going to be, but we're going to stop the medication just in case that's doing any damage to the organs. We're going to continue to monitor until we can reassess with blood testing, potentially here or at the clinic. What we generally ask people is if they come across a turtle on the beach, that's not normal for New Zealand. So we ask people not to touch them, but to call DOC on 0800 DOC HOT. And what they will do is they will organise someone to come out, assess the turtle, collect the turtle, and then we can assess it from there.